Wahiawa is a modern-day small town centrally located on the island of Oahu, with a diverse multi-ethnic population of more than 34,000 residents in almost 10,000 homes. Wahiawa is known as the Pico, or the center of the Hawaiian Islands, and home to the Kukaniloko birthing stones. Native Hawaiians regard Kukaniloko as an important sacred site. It was not only a birthing center for the ali'i, but also an agricultural center and educational center. Today, Kukaniloko is cared for and maintained by the Wahiawa Hawaiian Civic Club, keeping Hawaiian culture and traditions alive. The Wahiawa Center for Community Health aligns with the history of Kukaniloko by combining medical health services, medical career training, and the healthy lifestyle resources. The center will nurture the local population and link the past, the present, and the future. Kukaniloko is more of a healing area to where people could go, in a sense, like meditate to clear the mind, clear the body of problems that they have within themselves. And, just almost like relax, like I said, the mind to have no more problems.
The residents of Wahiawa are in the process of establishing their own community health center. Community health centers provide primary medical, dental, and behavioral health services to any person, regardless of their ability to pay. They also help people to sign up for health insurance and help with referrals to receive other services such as food stamps and housing. A community health center in Wahiawa will be able to serve residents right here in town, not only when they are sick, but also to ensure they receive annual checkups, immunizations, and other preventative health care, so that Wahiawa residents can stay healthy.
The benefit to a community health center is to synergize with a hospital so that these services can be used as referrals. In other words, the community health center can help offload those with poor insurance, uninsured or underinsured, and they can be referred to the community health center, and the community health center can in turn also refer clients back to the hospital.
Wahiawa General Hospital was founded in 1944 in response to the healthcare needs of the community following the attack on Pearl Harbor. Today, it is a nonprofit hospital with 54 acute care beds and a skilled nursing facility with 107 beds.
What's really important about the Wahiawa community is that we have Wahiawa General Hospital, and we want to work in partnership with the hospital to be complementary to the services that they provide. The Community Health Center can provide those pre-emergency kinds of assistance and help us live healthy, happy lifestyles.
Wahiawa General Hospital recognizes the improvements that are really needed in the Wahiawa area and the North Shore area. And we are striving to bring those resources to bear in conjunction with this initiative with FACE, which is a community health center approach to handling the medical needs as well as the social needs of the community.
Right now, Wahiawa residents that are uninsured or underinsured must travel out of the town to Waianae, Kalihi, or Ko'olaloa to other community health centers to receive the care when they are sick, or go to the emergency ward at Wahiawa General Hospital.
Of course we need a health center here. If you need health now, besides going to the hospital, you have to go to Haleiwa or Waianae or Waikiki. We have nothing here for us. We have nothing for the military people who aren't going to Tripler. They want to come here. We have nothing for the people here. We don't have anything for the people in Wailua. They have to go to Haleiwa. We have a large population here in Wahiawa. We need our own health center. Of course we need a health center.
The Wahiawa Community Health Center is very important for the town of Wahiawa. We're an aging community. Many of our members here receive Medicaid, Medicare benefits. Some of us are uninsured. We lost some jobs in the last couple of years. So a clinic would do and go a long way in addressing the needs we have in our community.
I think a community health center in Wahiawa would be beneficial in many ways. First of all, providing the medical services, which is important. We do have Wahiawa General, and then a few other locations in which are Mililani, but then further out, it's too far for most. But also it could provide the education that is needed, and especially having a place for individuals like myself that are promoting healthy lifestyles in school. We could possibly come out and reach other people in the community, not just in the school, but everyone else out there, to provide different kinds of activities and education and just awareness in general about how important it is to be healthy, but mainly to be active.
You know, I'm born and raised in Wahiawa, graduate of Leleho High School, and I'm proud and knew that. But Wahiawa really needs a health center because there's a lot of issues. There's a lot of homelessness, and they need access to health care and dental care. They also need education on smoking, because instead of eating, they're smoking. Then they need referrals to drug rehabilitation. There's needs for housing, just health education, and the list goes on. So having a Wahiawa Health Center would be beneficial for the community. So I'm really in support of that, and I want to be a part of that vision for Wahiawa.
Health and wellness of an individual is going to impact their family, the community, and the workplace. If we can have healthy individuals, then they can have a good job. If we have healthy individuals, then we can make sure that we lower our healthcare costs. If we have healthy individuals, then we can make sure that people deal with stress in a very proper way. So there's so many reasons why we need a health and wellness center to fill the basic needs of a community. And so I'm glad to be a part of this, and I really do hope that we can get this going off the ground very soon.
To create and develop a center for individual and community health for the Wahiawa and North Shore area. It is the goal of the newly elected board of the Wahiawa Center for Community Health to eventually create a federally qualified community health center that will provide prevention and necessary health care to all insured and non-insured residents. Also, the center will work to create a healthy community, including economic development, and will work to provide continual improvements for all health disparities that impact the ability of the residents to live healthy, productive, active, and happy lives.
My name is Mary Talon. I'm a Wahiawa resident. I belong to Our Lady Sorrels Church, and I'm also a member of FACE, Faith Action for Community Equity. And because FACE was granted this $80,000 planning grant for the Wahiawa Center for Community Health, this is one of our very first public outreach events that we've had. And I think that with a short period of time that we had to plan it, that has turned out very well. A lot of support from the community. I think we had a lot of wonderful opportunities for people to get free health testing, learn a lot more about other kinds of health organizations, and they got to eat a free lunch. So it's been a great day. Very, very, very well spent morning.
The Health and Wellness Expo was held at Wahiawa's Leleho High School campus. Health Academy teacher Janine Hosaka coordinated student workers to staff booths and even assist with medical screenings. Students from leadership, agriculture, and culinary programs also helped. These students will benefit from the education and career training opportunities that the Wahiawa Center for Community Health will offer.
So are you guys ready to perform our first number? Thank you again for having us here at the Wahiawa Wellness Expo.
My name is Ululani Duncan, and I'm actually a Hawaiian Studies teacher at Iliahi Elementary School. My duties basically are servicing the kids for Hawaiian Studies and the program itself, but I'm also an advisor of our group called DC Hui, which is Iliahi Elementary School's Hip Hop Dance Club. For the most part, it's giving them the activity that they need, that we really stress as far as living healthy, and through dance is what we do. We had the children display their talents, and then we had a crowd participation, which really wasn't too hard. The songs that we chose are songs that you do as a group. So people got up, people danced, and it was just great to see the many different faces, young and old, and having fun together, and it was a great time.
The reigning Miss Hawaii, Lauren Cheap, is a fourth-generation Wahiawa resident who knows the importance of being healthy.
Stay active. So it doesn't mean playing a sport. You can do whatever you like to do. Just go out and play.
Miss Hawaii inspired the community to stay active by performing her award-winning jump rope routine and then inviting the kids to participate in some jump roping fun.
The Wahiawa Center for Community Health is a vision shared by many. Community outreach efforts thus far have included focus groups, surveys at events, presentations at community meetings, churches, and neighborhood boards, as well as meetings with other healthcare providers and educational institutions. The response to the center concept has been overwhelmingly positive and collaborative. Wahiawa is ready for our Center for Community Health.
Wahiawa is ready to embrace the kind of change that we need, and this is part of our transformation to make us not just a more independently, economically stable community, but we need to be a healthy community.